My name is Melissa Ward, and I am nursing student, and I'm going to be doing your cardiac and peripheral vascular exam today. We're going to start by doing your jugular venous pressure. We'd have you lay in a 30-degree position and have you lay your head back and turn your head to the left, and we would take a straight looking for where it collapses, and then a straight angle across to the ruler and measuring across. We would say it was 2 centimeters and add 5 centimeters for a total of 7, which would be normal. From there, would palpate the carotids. So you can do both. Perfect, and it's strong and steady, no thrills noted. I'm gonna go ahead and auscultate while I'm here, listening for brutes using the diaphragm. If you could hold your breath. And you can breathe normal. And exhale and hold your breath. Perfect. So no brutes noted. Gonna go ahead and move on now and have you go in the left lateral decubitus position on your side. We're gonna identify the point of maximal impulse, finding the 5th intercostal space. So we used the angle of Louis for the jugular venous pressure, and so we'll use that to find the 2nd intercostal space and then count down to the 5th intercostal space and then down mid-clavicular line, feeling for the point of maximal impulse. Perfect. Feels steady and strong, 2+ grade. Same with carotids, 2+ grade. Going to then work our way back up. That's the mitral valve location for auscultation, and then up to, we'll just go back to angle of Louis. So 2nd, 3rd, so the 4th intercostal space on the left sternal edge is where the tricuspid valve would be auscultated, and then we would go up to the right 2nd intercostal space on the sternal edge, and that would be for the aortic, and then 2nd intercostal space on the left would be the pulmonic, and then the 3rd is the Erb's point, or the 4th is the Erb's point. No abnormality felt. Can't really feel pulsations with palpation at this time. So next, I'm going to go ahead and use the bell of the stethoscope to auscultate the point of maximal impulse for any murmurs. And if you could exhale and then hold your breath. No gallops noted, no murmurs. Also would want to listen at the 2nd intercostal for the aortic for any regurgitation. We'll do that with the bell instead of the diaphragm. Perfect. And no abnormal heart sounds, no gallops, no murmurs. So the next thing that we'll do is I'll just go ahead and listen for rate and rhythm in all of the locations. The tricuspid. And the pulmonic. And so no abnormal heart sounds, just the normal S1, S2, no clicks, rubs, murmurs, nothing abnormal noted on auscultation. Rate and rhythm are normal. Rate is approximately 60 to 70 and rhythm is normal. No abnormalities there. So what I'll have you do next is go ahead and move back to your back in a 30-degree. Yeah. All right, I'm just going to listen to heart sounds again. Perfect, no abnormalities. So next, I'm gonna go ahead and have you sit up on the edge and have you lean forward so that I can listen, and I'm gonna be specifically listening for the aortic murmur. And so if you could just lean forward. No regurgitation, and then okay, just hearing some stomach sounds, no abnormal heart sounds. All right, so no regurgitation noted at the apex. So now what I'll have you do is you can just lay down back on the bed. We're going to just look at your arms and legs, looking for any swelling, looking for symmetry, color, any kind of abnormality, skin pattern, looking at your fingernails for any cyanosis or clubbing. We'll go ahead and do capillary refill. Perfect and express in under 2 seconds. Looking for any abnormalities or swelling. No abnormalities or swelling noted. That being said, we'll go ahead and do the pulses, the radial, and it's strong and steady at a grade 2, and the brachial. And a strong +2, we would do that on both arms. And then want to look at the, it's epitrochlear nodes. And so you would hold the arm at a 90-degree angle on both arms, and palpating on the inner aspect for any nodes. No nodes are palpable. We would do the same thing on the other side, and would find no noticeable nodes. Looks like no venous pattern or concerns. Venous pattern is normal. So next we would do legs, and so we'll be looking also for symmetry, for any swelling, discoloration, venous pattern prominence, hair pattern is also being looked at in the legs, none of which is being seen. No discoloration, hair pattern is normal, no scars are noted. No, obviously normally wouldn't have shorts. We'll pretend like those aren't there, so I could see all the way up to the groin area. Would be checking for capillary or the nail beds for discoloration, checking capillary refill as well, holding for 5 seconds, release. It's brisk capillary refill, I'd say less than 2 to 3 seconds. And we would do that on both hands, both feet. And then we would do the femoral pulse, and you would palpate for rate and regularity, and it would be steady and regular. And then also would palpate for the inguinal nodes here, and then along the inside of the groin, and then the popliteal pulse. If you could just bend your knee up a little bit, which is strong and steady. And then we would do the dorsal pedal. You can do it on both. These you can do together. And then the posterior tibial. And all of them are grade 2, steady and firm, good pulses, no abnormalities noted, no discoloration. So the next thing I would do is have you stand, just so we can inspect for varicose veins. We would inspect normally all the way around, looking for any varicose veins. Nothing's noted, so you can just have a seat. So looks good, no ulcers, scars, anything like that. We'll do the Allen test, which will just check for arterial sufficiency in the hands. And so we will compress the arteries. And so what I'll have you do is go ahead and pump your hand open and closed 5 or 6 times. Okay, now hold it open. Perfect. And so we get a brisk return. And now I'm going to do it again on the ulnar side. So that was the radial side. So I'm going to compress and go ahead and pump. Okay, and then hold it open. Do the ulnar. Perfect. And it refills, and we would do that both sides. Now, in order to do the arterial insufficiency check in the legs, we would do the ABIs. So have him lay supine for a full 10 minutes, use a blood pressure cuff and the ultrasound to do the blood pressure in both arms, figure out which one is highest, and then we would do it in the legs using the dorsal pedal and the posterior tibial, and whichever one is highest. So then you would divide the right foot highest pressure by the highest pressure found in the arms, and then also you would get your number, and then do that also in the left. And it should be, we would just pretend for our sake that it was normal, so it was between 0.09 and 1.4. And so that concludes our exam. Thank you.